Hi, I'm Gene Liu, and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles. And I wanted today to talk about post-tonsillectomy diets, or what can I eat after I get my tonsils out. Almost everyone has heard from family or friends that it is a tough recovery. The surgery leaves you with little open raw areas in the back of your throat that generally take about 2 weeks, maybe 3, to completely heal. During that time, everything that you eat or drink goes past that area and can be very irritating. There's a reason why generations of kids have gotten through this with popsicles and ice cream. Cold things that melt are going to be the easiest to get down in the early stages, but that cold temperature also helps decrease swelling in the back of the throat and get you on the road to recovery a little bit faster. Over the next few weeks, you're going to gradually go more and more solid in consistency, warmer and warmer in temperature, and also more and more flavor over time. Anything remotely salty, peppery, spicy, acidic is going to sting. Another way to think about the diet advancing over the course of time is that you're going to start off with, let's say, baby food consistency things, and gradually to semi-solid or toddler food, and eventually back to adult food. To map it out a little bit more clearly, usually in the first day or two, it's cold things that melt, popsicles and ice cream. The next step is generally going to be room temperature, soft, mushy things. Think grits, think applesauce, think mashed potatoes. After that, you're going to be slightly lukewarm, semi-solid things like cooled down mac and cheese. Eventually, you're going to get back to hamburgers and even Taco Bell. But it's going to take 2 or 3 weeks to really get back to a 100% normal diet. We absolutely don't want anything like Doritos or Fritos that are super hard and crunchy and scratchy for those 3 weeks. Because there is a risk of bleeding after tonsillectomy until the scab is healed, some surgeons recommend not eating or drinking anything red in color. That way, if you cough or spit up anything red, it's probably blood and not going to be confused for anything you eat or drink. This recommendation is really a surgeon preference issue. It's not something that everyone recommends, so certainly something to discuss with your physician. Another recommendation that I sometimes hear about is to avoid dairy. Now, the idea behind that is that for a certain subset of patients, dairy products can make phlegm or mucus very thick and very gummy. That makes swallowing even more uncomfortable. At the same time, generations of kids have gotten through this with ice cream. So if you're not one of those people who gets super thick phlegm from dairy, have at it. Perhaps a little bit of good news is that most adults are going to lose 7 to 10 pounds in the recovery period. That's due to the increased difficulty in swallowing and usually a decreased caloric intake. Kids are going to not lose 7 to 10 pounds, but they may lose a similar percentage of their body weight. A lot of times, kids who have chronic tonsil issues may be a little bit underweight to begin with. After surgery, after recovery, they usually see a bounce in growth. It actually doesn't matter if you can get anything solid down for days. Your body is not going to waste away. It's going to be a little bit tough, sure, but you'll be physically fine. What you can't do is start getting dehydrated. It is exceedingly critical to drink enough to stay hydrated during the recovery process. Your best measure if you're staying hydrated is if you're going to the bathroom to urinate on a regular basis and that is staying reasonably clear. If you're noticing that you're going less and less, meaning not as often and also not getting as much out, and it's getting darker and darker yellow, you really want to start pushing the liquids and forcing the issue. Otherwise, you might end up needing to go to an urgent care or emergency room to get IV fluids. Hopefully this little video gives you a little better insight and understanding as to why we recommend eating and drinking what we do after tonsillectomy. Keep in mind these are just guidelines and there's going to be some slight differences from one person to the next, and there isn't a marched out exact schedule for what happens on what day. To reiterate though, you're just going to get more and more solid in consistency, warmer and warmer in temperature, and with more and more flavor over time. For kids, they're usually completely healed in 2 weeks. For adults, it's in 3. But you go at your own pace, but make sure you stay hydrated. If you have any additional questions, please leave it in the comments below.